The reality of our healthcare system is that physicians today have very little time to spend with their patients. Diabetes has, we did a study and we found out that people make about 100, between 50 to 100 different decisions on a daily basis when they're dealing with diabetes. And there is no way that a patient could, organize all of these questions for their physician, and physician systems would largely be overwhelmed. A lot of the responsibility or a lot of the day-to-day, hour-by-hour, minute-by-minute, decision-by-decision management of diabetes, is dependent on the patient. This new tool we introduced at ADA called SugarWise with Watson that really helps them. It's a personal diabetes companion, if you will. Diabetes Service and Solutions, the team, is focused on managing diabetes in between those two physician visits. So there are a slew of different things, diet, activity, behavioral, stress management, coping with diabetes, depression, that we can assist them with. And this assists not just the patient, it assists the physicians, it assists the payer system, it assists the entire ecosystem for diabetes management. It's a joint responsibility for everyone, but today, in the reality of things, this largely falls between the cracks onto the patient, and this is where we want to help them. What digital technology has done in our day and age is that it has compounded the amount of data available. There's more and more. You call this the Internet of Things. There's more and more devices available with digital data, and more connected devices available now that can basically. They say there's some estimate of like 4 billion or so connected devices that will be available, and several hundreds of thousands of petabytes of data that will be available. The next major breakthrough is, what are you going to do with all this data? It's not about just collecting data and putting the infrastructure together to just provide connectivity and providing static reports to patients. The next frontier for diabetes management, or for all of healthcare, is how do I make sense of this data? Diabetes is a data-driven disease. If you look at how people talk about diabetes, largely this conflict of managing their blood sugar. The frontier then is, how do I do that better? The frontier then is in cognitive computing, is in making sense of the context of the patient and giving them specific pinpointed recommendation that tells them what to do for their specific context. And then you've seen activity and Fitbits and others are now coming into the market. So nutrition, all of that data can now be accumulated to get a complete sense of what the patient is going through. And then with cognitive computing, in this case with our partner IBM Watson, we can make sense of all this data for the person with diabetes.